Thank you. Thank you again. I don't know if I'm really going to help us figure it out, because I wish I knew how to get proper funding. But I don't. But I can't stand up here and just say I wish I knew that for 30 minutes, so we've got to come up with some other things to talk about here. But so far, lung cancer as a disease has done a very poor job of raising funds. We are just horribly underfunded, and because we're underfunded, we're under-researched. And we've not been able to secure the funds either from government, from corporate sponsors, or even for private funding. But the things that we do know is that when we're able to put resources, when we put funding and we put great researchers behind a disease, we can actually change the course of the disease. And in my case, I'm committed to this because I have these two beautiful daughters that are now 18 and 21. And I would hate it for them to develop lung cancer at my age and the statistics to still only be a 15% overall survival. So if we look at how much money is being spent per death, this is NCI. Actually, the first one over here for the breast cancer is in the total government money. And they're spending something like $23,000 per breast cancer death. But for lung cancer, it's as low as $1,400. And it's a huge difference. But the 5-year survival rates are reflective of the amount of money that we're willing to invest in that. Breast cancer is now at 88% overall survival. Lung cancer, again, at 15%. Prostate cancer is at 99%. And part of the reasons, I think, for this, as far as what the government is, you think about the age of our congressmen. They're all thinking about prostate cancer, and their wives have dealt with breast cancer. So that is very dear to their hearts. But they have very few lung cancer survivors that come knocking on their door and talk with them. So compared another way, if you just look at the total research dollars, okay, the government will invest nearly $1 billion towards breast cancer research per year. That includes the NCI, CDC, and the DOD. Prostate cancer comes in around $300,000. Lung cancer, though, is very low. Okay, it's under $300,000 at $260,000, or $1 million, excuse me. So research per occurrence, if you cut and slice it a different way, so you look at, well, maybe how much is it per occurrence, not per death, not total overall spending, but how much are we investing per occurrence? Again, lung cancer comes in last place. There's just no way to look at it other than lung cancer is underfunded. But you look at total number of survivors, okay? So if you start looking at the survivors and you count your survivors as a number of Army, how many's in your Army? Well, breast cancer has over 2 million survivors now, okay, as does prostate cancer. Lung cancer, though, overall, at a given year, has about 350,000 survivors. These are people in treatment and those of us that have survived our treatment. So our numbers are very low. You know, the patients in treatment are just too sick to do much advocacy work. And the only thing that lung cancer leads in is the incidence, okay? We have more lung cancer patients than anything else. We're over 200,000 being diagnosed every year. So how do we get funding? You know, this isn't new. We don't have to recreate the wheel, but we can look backward. We can look at how did breast cancer do it? Were they able to make the money? There's over 800 foundations for breast cancer. There's only 20 such foundations for lung cancer. The largest on the breast cancer is the Susan Komen Foundation, and they have brought in $1 billion in the last 25 years. Their total number within 1 year was something like the last year, they brought in $200 million. So they've been able to really bring that up a lot in the last few years. And you think about the next 25 years, what are they going to be able to bring in? The Breast Cancer Research Fund was started in 93, and they've been able to bring in 237. This is private money in 15 years. That's on top of what they get from the government, okay? And you think about the other 800 foundations, there was simply not enough time to go through and collect. I don't know that anyone has a true number on how much is actually spent on breast cancer research. But one thing that we know is that you think about the researchers getting out of school. Where are they going to go? Are they going to go where they can get grants? The researchers in lung cancer can't afford to feed their families. They can't win the grants. And there's no money out there. If they can't get government grants, there's no money for private foundations giving them grants. They have to survive. They have to have a place to live. They have to feed their families. And they will migrate to where the money is. In 1991, breast cancer foundations formed the Breast Cancer Coalition. And they had over 180 groups, 180 private foundations within that. They didn't all come up with the same messages, but they came up with a plan of what they wanted to do. And lung cancer has yet to do that. And so far, I think we're just too polite. You know, we go and we knock on the doors and we say, we point this out. We are behind in funding. We're behind in research. But we're a little too polite with our messaging. So another group that I think that we maybe are more compared to is HIV and AIDS. You look at group ACT UP, okay? They came up with a strategic plan. And this was a very diverse group of people. They had a very negative stigma. They had a lot of the homophobia group in there. There was racism, classism, okay? These were a lot of very poor people, and sexism, okay? But they came up with a strategic plan about how they were going to create a movement. And most of that was based on fear. They convinced the U.S. it was an epidemic, and it was in our blood supply. It was going to kill anybody going in for any surgery. You could have an accident on the U.S., and you could be diagnosed with AIDS because you received a tainted blood supply. They were able to overcome their negative association with homosexuals and IV drug users. And they were successful because it was led by the HIV positive people themselves. And I don't think that you're going to find people that are as passionate about your cause if they're not directly affected by the disease. You can hire someone to do it, but they're not always, they don't have that passion. I think it's important that it's led by people that are touched by lung cancer, and it doesn't necessarily have to be patients diagnosed with lung cancer. A lot of times they're too sick, but it's their families that could be your advocates. It's the wives and the husbands or the sons and daughters that are left behind. Lung cancer is a public health crisis, okay? There's no way to deny that it isn't a public health crisis. And it does have a negative stigma. You know, they associate it with smoking. They feel like you have caused your own illness. You knew better than to smoke. But what about the 25,000 people that are diagnosed that never smoked? Or what about the people, and you know, it just doesn't matter how you got the disease. That's my point. It doesn't really matter how you got the disease. You deserve treatment. You deserve research for that field. You know, I don't know why cardiac doesn't sustain the same negative stigma. A lot of cardiac disease is caused by patients who don't eat properly or don't exercise. And I have never once on a cath table asked a patient in the middle of his heart attack, oh, gee, did you not exercise enough? You know, you've got this big belly here, and why are you in this predicament? We have few survivors. We have even fewer advocates. Families are hit so hard and so fast with this disease. The diagnosis comes, you're stage 4. The families feel just completely abandoned. And when the patient does pass away, a lot of times the families just want to go on. They want to move past that.